Hello, I am Dr. Khalilah Jefferson, DNP. Let's have an honest conversation about preventive care and why it matters so deeply for Black women. In the United States, Black women are disproportionately affected by maternal health complications. We experience higher rates of hypertension, preeclampsia, preterm birth, and maternal mortality, regardless of income or education level. And that is not because Black women are inherently unhealthy. It is because systemic inequities, chronic stress, barriers to access, and implicit bias in healthcare all play a role. That is why preventive care is not just routine. For Black women, it is advocacy, it is protection, it is empowerment. Annual Well Woman exams are an opportunity to monitor blood pressure, screen for diabetes, assess heart health, and identify risk factors long before pregnancy is even part of the conversation. Because maternal health does not begin at conception, it begins years before. When we talk about reproductive planning, contraception, fertility goals, and chronic condition management, we are building a foundation for safer pregnancies and healthier outcomes. If you have high blood pressure, diabetes, thyroid disease, or a history of pregnancy complications, those conditions deserve consistent monitoring and intentional management. And just as importantly, you deserve to be heard. Black women's symptoms are too often dismissed, pain is minimized, and concerns are overlooked. Preventive visits create space for documentation, continuity of care, and partnership. When you establish care with a provider who knows your history, your voice becomes part of your medical record and your care becomes more personalized and proactive. Maternal health equity means ensuring that every woman receives respectful, evidence based, culturally responsive care. It means screening for postpartum depression, monitoring blood pressure beyond the 6 week visit, recognizing that mental health, stress, and social determinants of health all impact pregnancy outcomes. But equity also requires empowerment. Know your numbers, your blood pressure, your weight, your lab results. Ask questions. Speak up if something feels wrong. Seek second opinions if necessary. You are not overreacting. You are advocating. Preventive care is one of the strongest tools we have to close gaps in maternal outcomes. It allows us to address risks early, to educate, to prepare, and to protect. Your health matters before pregnancy, during pregnancy, and it absolutely matters after pregnancy. Black maternal health is not just a statistic. It is about mothers, families, communities, and prioritizing preventive care is one powerful step toward health equity for yourself and for the generations that follow.